Hi, everybody. We're going to give everybody a few minutes to log on. We'll start shortly. Hi, everybody. Thanks for joining us. We're going to give people a few more minutes just to log on because I still see the attendee list is still jumping. So I want to give everybody another minute or so to be able to get on. All right, it looks like for the most part, a bunch of us are here and our attendee number is kind of plateauing. So we'll get started. Thank you for joining us today. We've been doing these webinars every week just to try to keep everybody updated with any changes that are going on throughout the agency as a whole. So we will get started. So our main premise for doing these webinars are to make sure that we can explain to everyone our current precautions, our communication plans, and things going on agency-wide that we're doing, any program-specific changes or updates, any frequently asked questions that we notice we're getting across different departments. We want to make sure that we're answering them consistently and concisely so everybody has the same information, and any potential expectations as we move forward. Our priorities at PCCS, as always, but especially during this time, are the health and safety of our workforce and the people we support, the continuity of supports and services, continuity and stability of employment, and consistent and transparent communication. And so those are our main reasons for doing these webinars, and we hope that they've been helpful. There is a chat box. If you have any questions throughout this webinar, as we go through things, please feel free to type them in and I'll read them out loud, and then we'll answer whatever we are able to. So we do have some great news to give you guys today through the advocacy that was done by parents and providers and people getting services. Community rehabilitation and respite can now be offered during school hours. So one thing that we need to make sure we do as the provider, we have to stick to the hours that were currently approved for a person. So if a person was getting 4 hours a week, they still are supposed to be getting that 4 hours a week. If they need additional hours because of everything happening with COVID, we need to work with the care manager and OPWDD to get those hours authorized. And we also need to document the need for service during school hours. Avero has built into the DA log under the COVID-19 section an area for us to document all of that. So please make sure we're doing that. Other great news is through the advocacy of parents, the hospital visitation guidance was released on 4/10. And what that states is effective immediately, hospitals must suspend all visitation except for patient supports, persons and family members and or legal guardians of patients that are in imminent end of life situations. So prior to this, a lot of the people we support were in the hospital alone. And now through parent advocacy, we can make sure that we're there with them. And so you can see the link to the guidance here. There's also a document that was created, 2 documents actually, in order to help parents and people we support and legal guardians and other support areas to make sure that the hospitals have all the information that they need about a person. So we will email this out after the presentation at the end of this week, but just so you guys can see it, this is a COVID-19 disability form. It's a 2-page PDF form. that gives a lot of concise information about how to support a person while they're in the hospital and things that medical professionals will need to know. Parent to Parent also came out with a healthcare notebook, and the link is here. They have it in English and in Spanish, so we'll be sending those out as well. We do encourage everyone to have those prepared in case there is a need for them. Some other updates that we have is the COVID-19 checklist is now on Paycom, which has a lot of resources and training compiled into one place. We will be adding to this as things change and as new information comes out, so please keep out on the lookout for that. I did want to share some free additional trainings related to COVID-19. So there is a system called Relias, and they have a variety of training topics from delivering telehealth all the way to how to mitigate transmission of COVID-19. The NADSP organization has a COVID-19 resources page, and OPWDD has a learning system, which they've put a variety of different content on there. Some related to transmission, some related to telehealth, and so on and so forth. So the link is there. You'll be able to access those. The other link that I am sharing here is from an organization called Open Future Learning. So PCCS does have an account, and for anyone that's doing telehealth or needs engagement ideas, this is a really great tool. They have something called side-by-side learning, which is learning content, meaning videos and worksheets that you can do along with the person you're supporting. So some of those areas might be behavior management, some are employment, some are learning healthy relationship boundaries, and so on and so forth. So please make sure if you need that resource, just email us and let us know. We'll make sure to get you set up with an account. And just to all PCCS administrators and our supervisors and program managers, please make sure to take advantage of any and all of these trainings to make sure you're prepared to answer questions that might come up from our staff. We did want to talk a bit about personal protective equipment. It seems like there have been some confusion, so we just want to clear it up. For self-directing participants and families, you can purchase PPE, and this can be reimbursed through OTPS. If you're unable to purchase, please coordinate with your fiscal intermediary coordinator, and we will make sure that your staff gets what they need to remain safe. PCCS employees, please reach out to your supervisor and we'll ensure you have what you need. We do have a pretty substantial amount of PPE, and we're making sure that we get that to you. We have sanitizer, soap, gloves, disposable masks, reusable masks, and then we do have some PPE specific for if you're caring for someone that is positive with COVID-19. So please let us know. We can arrange for that to be dropped off and or picked up at our building. Some of our outreach efforts that we wanted to go over, now more than ever, it's important that our DSPs are seen as frontline essential staff as they are in order to make sure that our workforce is visual. Our communications manager, Alyssa D'Augusto, has gone on a Facebook Live series to bring light to our field and is now working with SI Live to highlight the DSP workforce. And I just want to pause here for a minute because I know that a lot of people have been sharing packages that are being pushed through to legislation about essential frontline workers getting an enhanced pay rate of $25,000 for the year due to COVID and hazard pay. And if we don't have the visuals that we need in order to make sure that our workforce is seen as the frontline staff that they are, it's going to be very difficult to advocate to say that they should be included in these legislative packages. So we want to make sure that we have that for you guys. We need you to send pictures of doing direct service, testimonials from the family, the person you support. Please email us at covidquestions@pccsny.org so we can make sure that you're highlighted for all that you do. And PCCS supervisors, please make sure that you're encouraging your staff for these outreach efforts. As much as Alyssa and Kevin have been doing to outreach and put on social media, we can't be able to continue to do that if we don't have the content to do so. So please make sure that we're actively engaged there. Another thing that the Community Relations Department is working on is a collaboration video with all of us from different areas of the agency, people we support, families, administrators, and we're going to do it to the song We're All in This Together. So please email us if you'd like to be a part of that. We'd love to have as many people as possible. I think if I have the number correct, we need 90 people, but there's about 1,000 of us between employees and people we support, or probably more. So we should be able to get to almost 100. Some new business also about the PCCS building. We are resuming the main office to be open effective immediately, but please know that this is only for necessary use. So if you are going to need to use the building for either picking up PPE or printing or faxing or something like that, please work with your supervisor so we make sure that we can monitor how many people are in the building at a time. We want to make sure that everyone is adhering to the social distancing standards and do our part to flatten the curve as much as we can. Just another note, I know that we've been sending this out, but if you typically pick up a check from our main offices, please note that we are not doing this anymore. We will be mailing all of the checks out. So if you are looking to pick up your paycheck, we do really recommend going direct deposit if you can. It's a lot more convenient for you, but all checks will be mailed out still moving forward. So another fun thing that's going on is PS 373R and PCCS's Dehabilitation program have had an ongoing collaborative art class, which has now gone remote so others can join. So our Dehab program has had a group going into a classroom at PS 373 of second graders, and they've been doing art projects together for some time now, and they've now done this through Google Classroom. So if you would like to be a part of that, you can contact Evelise Segarra and she'll help set you up. Her email is here. It's esegarra@pccsny.org, and I believe she'll need your email address in order to get you set up with that. We will be having some other Google Classroom and virtual learning items coming soon, so please be on the lookout for that. Make sure we have your most current email. This is how we're sending out all of our resources. So if we are getting kickbacks that your email is inactive or it's not a valid address, please follow up with us so we can make sure that you get all the information that we've been giving out. If you're interested in seeing more live learning sessions, such as art classes or specific goal-oriented classes, please just let us know and send the email to covidsupport@pccsny.org. So we have been talking about the telehealth support groups that have been going on for quite a bit now. And they've been doing these support sessions just if someone has a question about food resources or how to cope with anxiety or stress or how to engage the person that you're supporting. Those have been in existence already, but what they did add is 2 support groups. So on April 23rd at 12 p.m., there's an employee session. And on April 30th at 12 p.m., there's a session for people we support. So this will also be emailed out and you guys should be getting it. It's also on our Facebook pages if you are interested in that. We have also partnered with SANUS, so the Self-Advocacy Association of New York. So we are going to be doing the self-advocacy meeting virtually. So that'll be on April 24th at 1 p.m. and you'll see this flyer going around as well. One thing that I did want to share, I connected on Facebook, not knowing that this person was a self-directed DSP with us. Her name is Brianna Long, and she is making plant kits. So they're only $5 and she delivers them for free. So I just wanted to put that out here if anyone was interested in that, or if anyone has any other neat home kits that you guys are doing or making, or another company that maybe you're a part of that's doing something and we can highlight it here. It's been a good tool to help keep people engaged, and especially for the younger children that we might support in ComHab or self-directed ComHab, it adds a nice part of their routine to their day. So watering the plant, making sure it gets enough sun, checking on it. So it's something to keep everybody busy, which is pretty awesome. So the link to her Facebook page is here, where you can see what the bags look like. And her email is here as well. It's Brianna, BREANNA 00519@gmail. So the next thing we want to talk about is AFLAC benefits. AFLAC benefits are an employee paid supplemental insurance. So what that means is it's an additional insurance on top of your typical medical insurance. And it could be for things from dental coverage all the way to hospital expenses. Typically, we only have open enrollment once a year. We are reopening that just so that way during this time, especially if anyone wants to join and take advantage of those supplemental packages. Unfortunately, with COVID-19, we don't know what our future brings. So we want to make sure that you guys have the accessibility to that benefit. You will be seeing a flyer come out shortly for the webinars that are going to be hosted, but the information is here as well. April 22nd at 1 p.m. and April 24th at 10 a.m. And I just included the link to the AFLAC website and our rep that we work with, Meredith, her contact information and her email. So some things that we want to look forward to the future with is OPWDD is working with provider agencies to try to ensure that each agency has the workforce that it needs in order to provide the services that we need to provide during this time. So it might come in the future that you can work at multiple agencies, even if you didn't apply there, and multiple agencies on Staten Island will begin staff sharing. So that's something to look forward to in the future. We have heard from some of our DSPs that due to COVID-19, even though they are actively available to work, that there's not enough work for them. So we are working with other agencies to try to alleviate some of that. And just thinking about how we are learning as a workforce and trying to use it in a positive light to inform how we can enhance our field and services moving forward. I know for me, I was someone that was very sort of against telehealth for people with disabilities in the beginning, especially for people with significant disabilities. I didn't really understand how that could work, but we are making it work, and we're seeing that there are positive outcomes out of this. So I hope that it's something that our field takes with us, and maybe our way of doing things can be improved a bit with realizing what we have the ability to do. So one thing to think about for the future is when we are back in, quote unquote, normal operation, it may very well not look and feel like it did before. So let's just think about that. Let it sink in. Let's learn from some of these experiences, thinking about, have your teams been more productive remotely? Have they found it easier to do their role? What have been the positives or negatives about working so remotely? So just some food for thought as we move forward. So I'll pause here. If anybody has any questions before we end, you can feel free to type them into the chat box. Oh, and Andrea from our HR department just wrote in that the flyers for AFLAC will be sent out as soon as AFLAC sends them over to us. So you should be seeing those shortly. While anyone is putting in any questions they have, just to let you guys know, we are doing these calls every Wednesday at 12. If this time is not working for many people or for families or people we support, please just let us know. We can do night or evening sessions or early morning sessions, whatever is going to be convenient for everybody. So, please just let us know at covidquestions@pccsny.org. And, we'll do our best to answer all of your questions and make sure that these times are convenient for everybody. So I really always like to end off on a positive note. So I found this and I thought it was really important to remember how to continue to empower one another as we go through this, encouraging resilience, teaching and mentoring, helping people break through their barriers, affirming their strengths, listening and offering advice, being vulnerable and transparent. I think that's something that is very relevant today more than ever, is just being honest about how fluid this situation is and how we don't exactly know what is going to happen tomorrow. And so that's another reason that we've been doing these webinars, in order to keep everyone updated as much as we can with as much information as we have at the time. And so the last thing that I do just want to add in here, I don't believe I included it in the PowerPoint, but the Justice Center, which oversees incident reporting for agencies like us, we do have to report all positive cases to the Justice Center in order to be able to track and gather statistics on people with developmental disabilities and staff and employees that are contracting the virus. So please make sure that you're reporting that to your supervisor, because we will have to report that to the Justice Center. That way we can make sure that our field is being accurately represented in all of the statistics that are coming out. So please feel free to, reach out to us if you have any questions about how to do that. But if you know of any cases that are positive that for some reason weren't reported or, haven't been in contact with us about it, please just let us know. But it doesn't seem like there are any more questions. So with that, we will end on just continuing to empower one another as we navigate through these uncharted territories. Thank you guys so much for joining, and I hope everyone's staying safe and healthy.